Yes, I've been working in this country for more than 2 decades now, operating on children as well as adults with congenital heart disease and rheumatic heart disease and other cardiac conditions. And it has been a very, gratifying as well as challenging experience, in the sense that we had to struggle to find a financial resource for all those children and adults who needed cardiac surgical procedures. So I got interested into, how to cater to the needs in a broader sense of the care to these people with NCDs. In the meantime, once I was invited to Rwanda during the time of global NCDI Poverty Commission that was formed by Lancet in Rwanda, and I had an opportunity to meet Dr. Jean Bookman and Anna Mukumbi and other experts of that field, and that was a great learning experience. So I started also taking part in this bigger campaign of making this care for NCDs among the poorest of the world. And we were invited by the Global Commission to form a national NCDI Poverty Commission in Nepal, and where Ministry of Health was also a part. And I was honored to be the co-chair, and we brought out a national report in 2018. So basically we highlighted the priorities for Nepal given the financial situation. And later on, this NCDI Poverty Commission converted into a NCDI Poverty Network based out of Harvard, which then actually got progress into initiative form of Pen Plus initiative. Again, we were offered a project that would support the initial years to provide support to the people with NCDs at the first level hospitals of Nepal. So that's kind of a good experience, starting from your experience to a report to a practical implementation of the solutions. So I'm glad to be part of this. Now, where are we now? I think we have selected 2 district hospitals in Nepal, one in Bardia and one in Jhapa, which is eastern part of Nepal. And the third site would be for training purpose. We have already launched the partnership project in Bardia. Now that was done by the secretary and other people at the Ministry of Health. And now that's the treatment protocols have been written in reference to the global document also, and that is endorsed by the Ministry of Health Training Center. That's a great achievement. Now, based on that, we already started training people at the district level. The care also has started to be delivered in the form of Pen Plus clinic. Again, it needs to be refined. The training has to go on further to a different sets of healthcare workers. But I think at least this is started. There is acceptance at the ministry, and the local community thinks it is important. So I think in summary, this is going to change. I think the way we take care of people with the commonest NCDs in Nepal. And this is going to change my own practice also, because there will be early detection of congenital heart disease, rheumatic heart disease, and other heart conditions. And of course, other NCDs for that matter. They will all be treated at the local level without the hassle to go to bigger hospitals. And if they need to be referred, then that would be done in a more organized fashion. So I think it's going to help communities, people, reduce the burden of disease, prevent early death, and of course it's going to change our practice in a better way. So I'm glad to be part of this big global initiative, and thank you everybody for bringing out this concept and letting us be the part of this. Thank you.